Wellness Communication Station's proud to be joined by Dr. Tony Coppola. He is at Gundersen Decorah Clinic. And Dr. Coppola, this time of the year, it's football season. We're overeating a lot on Sundays and stuff like that. And it's lots of chili and spicy wings and stuff like that. So heartburn. Most of us have suffered heartburn at some point. What are the symptoms? And I may have alluded to some of the causes, but what are the general symptoms and causes of heartburn, Dr. Coppola?
Yeah, I think most of us adults have experienced it at one time or another, but but it's often like a burning sensation in your chest or on your upper stomach or even into your throat. And a lot of times it'll even come out with like a sour taste in your mouth sometimes. And that's a sign that some of that acid's working its way back up. Sometimes it can present kind of sneaky, too, with like a weird cough that you can't explain. Or sometimes even dental erosion, the backs of the teeth. Heartburn can kind of sneak up on you and do things like that.
Wow. So lots of different causes for sure, other than the ones I mentioned, overeating during football season. Other than maybe cutting out some of that food or limiting your portions, what are some other things that we can do to prevent heartburn, Dr. Coppola?
Well, you hit it on the head. One of the big things is just being careful about what we eat and drink. Certain things stimulate it more, like caffeine, alcohol, tobacco, eating too big of a meal and then laying down. So just being a little bit careful about what we eat and drink, trying to eat smaller meals more frequently, and watch out for those things that stimulate a lot of acid production, like, again, caffeine, alcohol, tobacco, mint, tomato products, gum. Some of these things, if we make it a habit and we're doing too much of it, can stimulate a lot of acid.
We're talking with Dr. Tony Coppola from Gundersen Decorah Clinic about heartburn. What are some good treatments for heartburn, Dr. Coppola?
One of the easiest things, if it's really sporadic and not happening very often, it's just like Tums or Rolaids over the counter. You can take as needed, and what that does is it just neutralizes the acid in your stomach, and so that it's not quite so acidic and not quite so dangerous to the soft tissues on the inside of your food pipe. And so that's a pretty easy thing to do. But there are also other over-the-counter products like Zantac and Pepcid that you can get over-the-counter. That's kind of the next step up in strength. And actually, there's a little bit of a news story going on with ranitidine or Zantac right now because they were concerned about maybe a contaminant. So they're investigating that right now. However, still using it every once in a while for right now is totally fine. And then a little bit stronger than that would be like the Prilosec or Nexium over-the-counter that you can get and take once a day, half an hour before a meal. Those are really effective, and taking those for a couple weeks here and there can really shut down heartburn in a hurry.
Very good stuff from Dr. Coppola, Gundersen Clinic in Decorah. Thanks so much for joining us this morning.
Yeah, happy to talk to you, Pete. Thanks for having me.